Welcome to Natural Medicines. I am Dr. Kamal Patel, physiotherapist. Today we are going to discuss about disc prolapse, or you can say disc pain, and because of that what all complications we are facing. So, now you know all information about the disc. Disc is something like a soft cushion which is situated between two spinal bones. Just to avoid compressions over the bones and soft tissue like nerves, we have a disc as a cushion. I can give you a simple example, like how we have a shock absorbers in bike, or how we have shock absorbers in a car. Same way we have a disc in our body just to provide a cushion. Now, if we are sitting in a hard chair or maybe a wooden chair, after 5-10 minutes we start feeling to change our position. But when you are sitting in sofa, you can sit for maybe hours together. Why? Because you have a very good cushion, so you feel comfortable. The same way we have the disc in our body. Now, disc is made up of two material. The center of the disc is made up of a nucleus pulposus, that is just like a gel. So, when we are standing, weightlifting or doing different activities, because of that compressions, that force will be absorbed in that disc area, and the side boundary what you have, that is made up of a plastic material. We call it as a annular fibrosis. So, when we are doing these different activities, we are applying a pressure over the disc. This pressure is being absorbed by our disc right from almost 3 to 4 years of the age. So, as we grow older, this disc gets harder because of wear and tear, or maybe a less blood circulations in that area, or maybe less nutrition provided by our food. That all can leads to a early damage to the disc. Now, why disc is getting prolapsed or why disc is getting degenerated? I can give you simple examples. See, according to our body formations or body structure, we are doing all the activities in forward bending. A common person might be bending around 15 to 20 times forward to do house chores or maybe a required work. But have you done any time backward bending activities, or have you done any backward bending functional movements? No. Why? Because we are made up such a way that we have to do all the activities in bending forward. So, according to one expectation, a 40-year-old person might have bent around 4 lakhs time forward for doing different activities. Same backward bending he might have done in some hundreds. So, this imbalance of doing activities like bending forward activities and bending backward activities leads to a lot of pressure on the disc material, and because of that forward bending activities, discs are tend to push backside. Yeah, you can understand. Think that this is a one bone, over that I have kept a one balloon filled with the air, or you can say with the water. Over that I am keeping one more bone, and when I am bending forward, what I will do? I will be compressing front portion of my disc. When I bend forward, I will be compressing front portion. So, when I am compressing front portion, the gel whatever is there in the front portion area will be pushed to backside, high pressure to low pressure. So, when we are doing bending forward activities, disc material is tend to push backside, and when our disc boundary, which is made up of like a plastic material, gets weaker, and with the force we did some activity, or we do some particular activities repeatedly, disc starts changing its shapes, just like plastic boundary start getting stretched from some portion of the disc in the backside area. So, once this is happened, after that you have some nerves which is going down from the disc originating area. So, these nerves which is going in a leg, when it comes in contact with this prolapsed disc, you start getting a back pain, and even pain will start radiating in your leg also. Initially, when the disc and this sensitive tissue nerves comes in contact with each other for first time, we have a acute spasm, that is called as a muscle catch in a lower back area. So, we see so many patients who come to our hospital and complain that they are not moving at all, they are not able to move their body at all, and that might have happened because of just lifting some gas cylinder or maybe a bucket of water or while doing some bending activities. This happens because once you are damaging this disc area, to know ourselves that we have done something wrong, our brain sends a signal to our low back muscles to protect that area from further damage. So, this is called as a protective muscle spasm also. When you give a proper rest initially for 3-4 days, pain starts subsiding and you will be able to do different activities. But when this complaint becomes a chronic, when you are doing it for too many times, you got a pain first time reduced in 2-3 days, you got second time pain maybe 1 week required, third time pain maybe 1 month required. When this happens repeatedly, there will be permanent changes in the disc shape and there will be permanent changes in the nerves passing area also. So, there will be like canal stenosis or nerves will be compressing permanently. In those cases, after doing any kind of treatments also, you will be reducing your pain to some extent. You will not be able to reduce your pain completely, you will be having a mild irritation in your leg, or you may have a mild discomfort in your back throughout a day. Even if you lie down also, even if you are sitting also, you have that discomfort. So, these were the common informations about the disc prolapse and pain what we get in the leg because of disc prolapse. Now, once disc is prolapsed, usually we advise some of the activities along with the medications or treatments. Say like some person is overweight, then for him to get a disc problem and this nerve irritation chances are more. So, those people if can reduce weight, that will be very wonderful and they can be out of pain faster. Second, if there is any muscles weakness, stomach muscles or you can say abdominal muscles or lower back muscles are weak, there will be more compression over the disc and nerves also will be getting irritated. So, in those cases also, if you are improving strength of abdominal muscles and lower back muscles, you have more chances of coming out of this pain. Third, very important part what you can do when there is a disc prolapse is try to do backward bending exercises. As we said, usually disc prolapse happens because of forward activities which is like happening too many times. So, when you start doing backward bending exercises, the sensitive nerves will be less pressurized by the disc over that area and pain will start subsiding very faster. The second very important thing you can do next for the disc prolapse is you can modify your physical activities. Usually bending forward activities, weight lifting activities are having more risks to get the disc prolapse. So, those activities if you can modify like a weight lifting, you can divide weight for 2 or 3 times, so that there will not be more compressions over that. If you are doing any activities in bending forward position, try to do in sitting position, try to sit down in a chair and adjust that work whatever you can do in front of you, or you can sit down on a floor and also you can do. So, these are the common informations which can be helpful for controlling a disc prolapse or which can be helpful to manage a disc problem properly. So, if you like our channel Natural Medicines, please subscribe and press a like button and press bell button. Thank you.